Utah, we're very fortunate to have the quality of health care. We're rated at the top in quality and the top in affordability. Health care is expensive to everybody in the nation, no doubt, but still, given the fact that almost 90% of our people have health insurance, they're getting just top-notch health care. The traditional relationship between medical professionals and people who have suffered an injury through medical events, malpractice, et cetera, an adverse medical outcome, the relationship has typically been the lawyers take over, and what sets in is called deny, delay, and defend. But in the last decade or so, systems have realized, look, this is about the patient. That's why we're here. We're here to help the patient get better, improve his or her quality of life. So when an adverse medical event occurs, we want to keep that doctor, and nurse, and hospital, and the patient together, working on the patient's future and getting him whole and well again. So we now have a program called Early Disclosure and Resolution, which leaves the lawyers on the sidelines, and it's the whole system is working with the patient, A, to get them better, and B, to address any needs they may have because of that adverse outcome. It's notable that where this kind of early disclosure and resolution has been implemented, that the number of claims has reduced significantly and the number of lawsuits has plummeted. Moreover, the patients who are injured, and this is a rare event, but it happens, you know, it just is going to happen. The patients receive a more logical settlement. They may not need to retain a lawyer. And instead of a lottery system where this guy wins big and that girl loses big, we have something that's pretty normal across similar injuries. So it's really a wonderful system because it concentrates on the patient and it treats all patients similarly. Several of our hospitals have looked into similar kinds of practices and programs, but the Governor Herbert, asked his health summit, of which the Hospital Association, Intermountain, and others are a very important part, to look into the issue of tort reform. He asked me, when I was Lieutenant Governor, to lead that effort, and so we've developed this early disclosure and resolution system. We've really stolen it from other parts of the country and assembled it together. It's worked well there, and we're starting to implement it here. We'll report that to the Governor in December. And we also have a federal grant where we have a couple of doctors who are pursuing this program, how it might look like, how we implement it across the state. And frankly, we're the envy of other states right now. Washington's trying to implement it, other states, and they're having a hard time. We have a great environment here in Utah with Intermountain, the University of Utah system, and others, our for-profit hospitals, where there are fewer people to deal with, and it's going to make a real wave, I think.